Good afternoon, Egyptian Preventive Cardiology Working Group. Today I will be talking about the results of our group polls and surveys, and it was about social media in medicine. Social media networks are dynamic internet websites that allow people from all over the world to communicate easily and share information between them. This signifies the power of social media in shaping the future of medicine, politics, communication, and surveying population. We used social media, exactly here, Facebook group, to probe the certain attitudes, lifestyles, and patterns of clinical practice in a novel way. We created a Facebook group with more than 3,000 healthcare providers linked to the activity of CardioPrevent to spread updated medical data and conference news, and used this group as a platform for data collection. We started by posting to make all participants aware that the polls will be considered in our survey, and we encouraged them to solve it. And this was our consent for performing this research. We created 116 polls over a period from June to September, and 25 relevant polls were included in our survey and left open for contribution to all group members, and questions having less than 15 replies were excluded. The data were collected and transformed into information. Descriptive data analysis was performed, and results were plotted on graphs. We tested issues uncovered in previous papers, including doctors' lifestyles, patient-doctor relationship, and communication using social media, lifestyle patterns of applying guidelines on their daily practice, and their insight for career development. Now let's turn to the results of our study. Actually, the study population were described as mostly cardiologists, representing 73% of the population, and other people were also included from healthcare providers, including 3% epidemiologists, 5% medical researchers, 8% internists, and 11% of pharmacists. The years of experience of the people joining our group were mostly more than 20 years, 54%. The surveyed population included people from 20 countries across 4 continents: Asia, Africa, Europe, and Northern America, with the greatest representation from Egypt, represented around 2,000 healthcare providers, and the least representation from Vietnam, representing around 10 healthcare providers. Now we have asked the study population whether they are happy with their career or not, and 82% replied with yes, because actually most of the study population were experienced healthcare providers of type A personality who believe that the effort is most counting in life, and they have frequently used mobile apps and new technologies to learn new techniques and updates in scientific researches. Most of them were happy with their careers, and experience may be the contributing factor to this, as most of them have more than 15 years of experience, making them at the peak satisfaction and achievement according to the International Career S-Curve. We have also tested issues like social media and the new gadgets used in medicine. Actually, most of the participants said that social media provides an easy and cheap, engaging way of learning and getting new information. And that's why most of the doctors recommended the use of social media to be updated in fast growing medical information, affecting and improving knowledge and behavior in different regions, but not clinical practice skills, because it actually needs to be acquired from a workplace. The electronic health is extensively penetrating in our daily practice. Healthcare providers also use generic apps such as WhatsApp and Facebook to communicate with their patients because it provided a fast and cheap, readily available communication platform working throughout the day. Also, electronic health system is penetrating the practice. New gadgets, for example, like the Apple Watch for doing ECG, were not recommended by physicians, and this may be due to the lack of scientific evidence on the reliability of such gadgets in results. Now let's turn to the lifestyle modification and doctor-patient communication. 90% of the doctors participating in the study showed that there are difficulties in communication with their patients, and they also believed that the lack of good doctor-patient communication is interfering with the achievement of lifestyle modification. Not only did doctor-patient relationship affect the lifestyle modification, but also the wrong concepts and misbeliefs always interfere with the lifestyle modification. It was always difficult to convince your patient to quit smoking. When we asked about the doctor's own lifestyle, they were not living a healthy lifestyle that is enough to be a role model for their patients. And regarding obesity, most of the healthcare providers were overweight or obese and aware of their problem. They wished to lose more than 10 kilograms, but their weight is stable, and they returned the cause to the physical inactivity and the sedentary lifestyle and chronic stress. Regarding smoking, this question was excluded because of the poor response rates, as most of the group members found it shameful and penetrating to reply to such a question. The decreased physical activity, even walking, they didn't walk on regular basis, and this may be due to the lack of time and the increased burden of work on the physician. Regarding medical screening, healthcare providers have preferred office measurements. We randomly chose two of the office measurements, which are the blood pressure and weight, and asked about them, and they showed regular weekly monitoring of the weight and blood pressure. But on the other hand, lab investigations were not as regular. We have randomly selected two of the lab investigations, including hemoglobin A1C and lipid profile, and they have never done them. Most of the answers were actually never. This may be due to the fear of needles or high cost of lab investigations, although they are at the mean age group for screening, as most of them are middle-aged, between 35 and 45 years old. And although healthcare providers were aware that the control of the risk factors for cardiovascular disease should be started early in life, they were not keen on eating vegetables and including 5 calories in their dishes. Now let's turn to patterns in following the guidelines. Actually, 41% of the involved healthcare providers have read the latest European guidelines within 2 months of its release, and most of them have implemented it in their daily career practice. We added a link to the guidelines, and people had the chance to renew their information and read the latest guidelines. Also, most of the involved healthcare providers have not been using aspirin already or stopped using it, and for primary prevention of cardiovascular coronary artery disease. And this signifies the effect of social media and new communication platform in the rapid spread of clinical trials results and data even before it's changing the guidelines. We have also used social media to discuss the debatable issues like the hypertension treatment targets. And in conclusion, the social media plays an important role in healthcare providers' education and their doctor-patient communication. Electronic remote patient monitoring is on board. Our group consensus: social media can be used to correct the public wrong traditions and misbeliefs. There is a gap in doctor-patient communication skills, and that should be a focus of future educational programs for physicians. Medical staff should start by improving their own lifestyle to be a role model for their patients, as this point was lacking in our data. Professional social media networks can be a good alternative for rapid global spread of medical knowledge, such as the guideline. At the end, I would like to thank everyone who participated on that survey, especially member of the group Cardio Prevent 2018, for making that research comes to light, and I would like to thank Professor Bassem Zarif and Professor Iman Labani for their dedicated help and supervision and invitation. And it was a great privilege for me to present you this presentation today. Thank you.